So you just found out you're pregnant. Congratulations. Or you want to get pregnant, you're trying to get pregnant, or you're just curious about what this pregnancy thing is all about. I'm going to show you visuals every single week on how your baby looks on ultrasound. Starting at week 5, baby is about the size of a sesame seed. So on ultrasound, we will not see baby at week 5. At this stage, we'll normally see a gestational sac in the uterine cavity to rule out any type of ectopic pregnancies. Also at the 5-week mark, especially at the 5-week, 5-day mark, we will see a yolk sac, which just look like a tiny little circle inside of the gestational sac. Even though we may have not seen baby during week 5 ultrasound, do not worry. Wait until next week and I'll show you exactly what we will see at week 6. We are at week 6 now and your baby is the size of a sweet pea. But if you're getting an ultrasound this week, this is a little bit more exciting because we should hear baby's heart rate. Yes, you heard me, the golden sound. So just like last week on ultrasound, we should see that gestational sac within the uterine cavity. We will also see that white little circle we talked about, which is the yolk sac. And then we should see the fetal pole, aka the baby. And right in the middle of the baby's chest, you should see flickering. That is your baby's heart rate. Now keep in mind, 6 weeks is still very early, so some women may not see their baby as early as 6 weeks, which is why I personally like to wait until the 7 to 8 week mark, and I'll explain that more in the next video. So is week 7. Now we cooking. Like literally cooking. Like you cooking up a baby. So for the ultrasound, we're going to see the gestational sac, the yolk sac, and we're going to see the fetal pole. Now, if you did not see your baby's heart rate last week, I am hoping that we're seeing your baby's heart rate this week. Like it should be guaranteed at this point. And this is why I like to do the ultrasound 7 weeks and up, because there's really no gray area here. We should see a fetal pole and we should see a heart rate. This week, your baby has graduated to blueberry status. So that means baby's just a little bit bigger, which is so cute. If you've gotten an ultrasound at 7 weeks, you can start to see the shape a little bit. But at 8 weeks is when we really start to see the shape. And I cannot wait to show you that on the next video. We're at week 8. So now your baby has grown from a little blueberry to a raspberry size now. But on ultrasound, the baby to me looks like a little bitty little gummy bear. And I'm going to show you why. Just like we talked about in the last video, this baby actually has a shape now. So you'll normally be able to see 2 arms and 2 legs in this ultrasound. And I just love that because this is so much fun for the mom and dads. If you're lucky, you'll also get some little wiggles from your baby, but none of the wiggles compared to all the moving the baby does at 9 weeks. So I'll talk about that more in the next video. So now you're 9 weeks pregnant. And if you've had your first ultrasound appointment at the 9-week mark, you've probably been given the option to look on top of your belly instead of transvaginally. And that's because your baby is bigger now. At this stage, your baby is the size of a green olive and is moving around like crazy. At 9 weeks, I don't know what it is. I've always experienced the baby moving so much at this stage, and the parents are always so excited to see it. At this stage, you can clearly see the little black circle where the brain is forming, and I love to point that out to the patients. I also like to show them where the umbilical cord is inserting into the baby as well. These are just little things sonographers do to provide reassurance. And next, we're going to go into what your baby looks like at 10 weeks. At 10 weeks pregnant, your baby is about the size of a prune, which is funny, right? Because you probably can't even use a bathroom and is constipated because of your pregnancy symptoms. Yeah, that's not fun. However, we'll take those pregnancy symptoms because that means baby is thriving. At this stage on ultrasound, your baby is pretty much long enough to get an actual profile. At this stage, we'll probably be looking on top of your belly by now, and we'll be getting you an actual profile of the side of the baby, which is a beautiful picture. Certain organs like the stomach and the baby's bladder is pretty visible at this point. And if you've been sick, hopefully you're starting to feel a little bit better at this point. But if not, I'll see you in week 11. It's week 11 and we're almost done with the second trimester. I hope you're feeling better. This week, things are starting to get a little serious because we are about to start doing the nuchal translucency exam on your baby. That's a very important exam where we rule out any trisomies, and that's also coupled with blood work. This week, your baby is the size of a large strawberry. Even though your baby is still relatively small, on ultrasound, your baby looks a little big. He or she has went from a sesame seed to a large strawberry very fast. You may see the arms and legs more defined. You may see fingers and toes this time. You should be able to get really good profile pictures at this stage. But next week is really important because at the 12-week mark is when we do what's called the nuchal translucency exam. So I'll talk to you more about that in the next video. Finally made it to week 12. Yay! And at this point, you should be feeling a little bit better. Second trimester is around the corner and things are going to start picking up in a positive way for you. This week, we're doing the nuchal translucency exam. We're going to check behind the baby's neck to make sure it does not exceed 3 millimeters. Any measurement exceeding 3 millimeters can be a little bit concerning. Consult with your doctor for further information if that is true for you. This week, your baby is the size of a lime, which is a really big jump from last week. At this stage, we normally see the placenta starting to form. We'll be able to tell if it's going to be anterior or posterior. All of the organs are officially there. We're just making sure that the baby continues to grow and the organs continue to grow the way they're supposed to. I really hope y'all enjoyed this short yet educational series. If you want me to do the same series for the second trimester, just let me know in the comments. Bye.